Hi everyone, welcome back to the Geeks of Texas, and today I'm going over another nursing video. Today I'm talking about 12-hour shifts and how I get through them. Let's discuss. 12-hour shifts. If you've never had one, you don't know what to expect. So I'm going to go over a little bit of what it's like to be a nurse on a 12-hour shift rotation. So for me personally, I like to do 12-hour shifts. I prefer my 12-hour shifts 3 in a row. And if you're a nurse and you've worked anywhere where they do 12s, you know that 3 in a row is pretty heavy, and probably at the end of it you are done. So to start off with, if you've never done 12-hour shifts and you think, you know what, I only work 3 days a week, and they're like, well, that's not that bad, and then you do the 3 in a row on top of that, and then you start to say, well, that's okay, that's not that bad, but let's break it down as a nurse's perspective. You come into the hospital, and this goes for anybody: nurses, phlebotomists, CNAs, PCAs, respiratory therapists. When you come in for 12s. You usually are not here for 12-hour shifts. You're coming in early, you're getting report, you're charting everything you got to do, and throughout the day you have a fluctuation of all kinds of activities that happen in the day, and you're not leaving. You're at least 13 hours in a day of a shift on a good day. You try to do as best as you can throughout the day, but in the end, sometimes you have wound care that you need to do. Sometimes you have to get hold of that doctor. Sometimes there's a lot of things that happen in that shift that keeps you here a whole lot longer. So for me, I like to do my 3 hours in a row, and what happens is I end up doing this routine where I have to get up early. I have to be up to be in the hospital at 6:30 to have a 12-hour shift to actually end my shift appropriately at 7:15, 7:30. A lot of times it comes out to 8 o'clock at night before I'm actually out the door. Most of the time it's a lot longer than that. And, whatever that happens. And then, you go home, you're going to eat, taking a shower. If you live maybe 30 minutes away, like in San Antonio, we actually commute a lot in this city. And if you live 30 minutes to an hour away, that takes into the time that you get to sleep. I mean, you're definitely not making your 8 hours, especially if you're making your breakfast or doing everything you got to do, and you have to come back and cycle it back throughout the day. Now, the pros to having 12 hours and 3 in a row is I get those 4 days off. Now, yeah, you're doing that routine over and over and over again, and at the end of it, I'm dead tired. I don't want to do anything. I just want to come home and just veg out and just pass out and wake up the next day. But once I wake up the next day, I'm refreshed. I got 4 days off, and I get to go hiking. I get to go camping. I get to make more YouTube videos. I get to do all the things that I like to do personally, and I get that out of the way. I personally like to do my 3 days, Monday, Tuesday, Wednesdays. That way I have my Thursday, Friday, Saturday, Sundays off. A lot of people actually like to work on the weekends because you get that differential and that shift differential, and you get extra money for it. But right now I work it out with another nurse that he does his 3 in a row, Friday, Saturday, Sunday. I do mine Monday, Tuesday, Wednesday. And I prefer to actually be off during the week and to do things because it gives me a little bit more free time. I'm not in the big crowded areas where everybody else is having the weekends off. But it kind of does give me the freedom to have a more social life, to have people more involved in the things that I do. Let's talk about what's going on in those 12-hour shifts. At the end of the day, you're so tired. But why is it? Anytime you see a nurse or anybody in interdisciplinary care, you see the respiratory therapist, the physical therapist, or the PCAs, any of these guys, we're out there, we're walking around, we're running back and forth from patients, especially the nurses and the PCAs. We're on the floor, pretty much the grunt work of everything. And what we're doing is we're in and out of every patient's room. We're starting IVs, we're hanging antibiotics, we're giving medications, answering doctors' calls when they're on the phone or even at the nurse's station and they're putting orders in after they just saw the patient. They want to give you updates or what the plan of care is. You do this with multiple doctors. A lot of times you don't just have one. You have your hospitalist. Sometimes if you have a cardiologist, sometimes you have a wound care doctor, surgeon, any of those things. And you're having to answer these doctors every time. A lot of times you go in with the doctor and they want to, explain some things, or maybe you're in there with a surgeon, they want to do some dressing changes right there on the spot, and you're there hands on, and you don't get to be with your other patients at that time. As soon as you leave that room, you're running out to see those other patients, or the things that you had been piling up on you, that you didn't get past those meds right on time. Somebody's calling for this or that, and you're just nonstop moving. I'm telling you, I got my smartwatch here, and I get tons of steps in. I'm hitting, my 10 to 20 at least thousand steps a day running around here, and your feet are beat up. And if you know me already, I have some injuries from the Navy, from where my ankles are real swollen. My legs and my back is all from an injury, and so I am swollen. My ankles look like baseballs at the end of it, But really, what helps out is you got to get some good shoes, and you got to change those shoes out. A nurse's shoes are probably changed out probably every 6 months, and you got to get some good running or walking shoes. Now, I don't believe in the clogs or anything like that, because I just don't think those provide the support or the ability to move around like you really need to do in a hospital. That might work for something that's a little bit slower pace, but not in a hospital. You're moving constantly, so got to get those. I've heard of a lot of nurses swear by compression stockings. I personally can't wear those. I got real big calves, and they just keep falling off, and they just don't really do anything for me. But I hear that they work great. A lot of the times, if we do have time to chart, we're doing it on a cow, or a computer on wheels, like we like to call it. And we're standing up, we're charting, and we have this because we have to be any moment's notice to get up, use that computer to go give our medications, to go give any information to a doctor, or move back and forth between a patient's room. And we can't just be tethered to a nurse's station. We are up, and a lot of times you'll see down the hall, there's nurses that are standing up against the wall just charting away. And believe me, we're not playing computer games or card games on there. We are actually doing some serious work. We're updating our patients' charts. We're reviewing any kind of orders, any kind of chart updates that came in from doctors, PT, CT, any kind of radiology reports, lab work that came in, anything that goes along with that. A lot of times medications, we have to see if we can hold them or we give them, depending on what's going on. These computers, it seems like we're attached to, but it is pretty much your entire chart and care goes into that. And we don't get a chance to sit down from there. At the end of the shift, a lot of times we're working right up until shift change. We're giving medications, we're doing turnover, and we don't get that luxury of sitting down for very long, if at all. And really, people just don't understand just how busy a hospital is. Today I had to use the restroom 3 times, and I was holding it for a few hours at that time. And I'm telling you, I understand, you try not to do any UTIs or anything like that, but I'm telling you, you're holding your urine, because at the time, a lot of times it's easy to say, oh, why don't you just stop and go to the restroom? But you really can't. You're having call lights running back and forth as you're passing by. You're having patients calling you. You're having a doctor calling you right here. You're like, oh, wait, let me do this real quick and get this done. By the time you get to that restroom, you've already been called a bunch of times. It's been 2 hours. You don't realize how long it's been. And you're standing there in the patient's room. Sometimes you're trying to give a medication, trying to do that IV push kind of real slow, and you're just standing there sweating it while you really got to urinate, and it's rough. Let me tell you, it's bad. But once you finally get your release, then you come right back out, and you got to get right back into it. You don't have time to change. And that leads into another thing of not being able to eat. A lot of times I'm here for 12 hours, and I come in and I have like my protein shake for breakfast, but for lunch, I can push lunch out a lot of times to 3 o'clock is my normal time of eating. I go from the time I have my protein shake in the morning from around 6:30 all the way to 3 o'clock in the afternoon. And a lot of times I'm eating lunch maybe 5 o'clock, or even I don't have a lunch. As nurses, we don't get to eat, we don't get a snack. We can't have any food at the nurse station, so we can't snack. We have to have a hydration station where we keep our water bottles in there, and that's if you have the luxury to actually have a few sips of something to drink while your shift. And I know that's strange from the outside looking in. I've talked to other friends, and they're like, well, why don't you just go pee real quick? I wouldn't do that. Or like, why don't you just have something to drink? It's like, I would stop to get something to drink. And you would think that's something as basic as any kind of thing in your life. And really, it's a luxury that nurses just don't have. And maybe that's something that you really need to appreciate your nurses for. Another good thing about having 3 in a row is this thing that we like to call continuation of care. And that's where we get to have our patients multiple days in a row. We get that more of emotional feeling that we can get to be personal with them. We come in, do our history with them, with the doctors, and get the big picture together. And we get to know this patient. And then over time, it's now we just roll into it. We know who they are. We're not spending so much time trying to figure out who they are. We now get to talk, we get to know about them personally, we get to know their families, and the families get to know us a little bit more, and they feel more comfortable talking to us. And when we do this patient education, especially at discharge, when we're trying to talk about their care, they understand that we actually do care about them, and I think it feels a lot more personal. And I really like to have my 3 in a row. That way, when I come in, I might have half of my patients now are not new, but they are people that I've known from the previous day before. I may have admitted them before, and then I get to discharge them. I get to be there for the whole scope of their care. And that really helps with my education as a nurse, where I really get to understand how everything comes together and pieces together. And I've found that I've learned more by having that continuation of care. I learned that I can see the whole aspect of care from start to finish, how we order, what to anticipate that the doctor is going to order, and how that's going to affect the patient. And that way, when I have the patient discharged, I can give them that patient education. That way, when they first come in for that admission, I can tell them, this is probably what's going to happen. I can be more at ease with them, and they can understand where I'm coming from, and I can explain things a lot better by just going through it, because I have been through the whole aspect and the whole plan of care with them through the days leading up to that. I want to thank you for watching today, and if you like this video, go ahead and like and subscribe down below. And if you have any ideas of what I should do next, or any topics that I should have, or anything that you want to discuss with me about this video, go ahead and hit that comments, and I'll be sure to read them and get back to you with them. Thanks again.